Hey, Tomas here. Welcome to another video in the Clinic Success Academy. By the end of this video, you're going to have the exact 3-part script for presenting something like Botox in your clinic. So we're going to get pretty tangible here. And more importantly, you're going to see the value stack framework from the previous video applied to a real treatment, word for word, so you can hear exactly how it sounds. Again, this will also apply for outbound and inbound. Let's get into it. So a patient calls, "Do you do Botox?" That's the moment. What comes out the front desk's mouth in the next 30 seconds decide whether you book a consultation or not. Or you just get a, "I'll think about it." Most front desk lecture about Botox. They'll explain the areas, the units, the longevity, the pricing, all accurate, but none of it converts. So again, we've gone through this in previous videos. People skip information and you need to go back to what the patient wants or who they are as a person. Again, better front desk apply the value stack. There's going to be 3 steps and this is how they work on a real call. Step 1, as I mentioned, start with the clinical label. We've gone through this in a previous video, but you're going to follow, once you've gone through the clinical label, you're going to follow it immediately with the plain language translation. Botox is a purified protein. What that means is it gently relaxes the tiny muscles under your skin that are causing those fine lines. It doesn't change your face, just softens the movement a bit. Now notice what that sentence does. Purified protein gives you clinical credibility in 2 words. Gently relaxes translates neuromuscular inhibition to something a 9-year-old could picture. And doesn't change your face. Pre-handles the single biggest patient fear before they have to awkwardly raise it. So here's the mechanism behind that last line. Again, it's good for you to know this. 8 out of 10 first-time Botox callers are not afraid itself. They're afraid of looking like they've just had it. The frozen forehead, the overdone, done eyebrow. That's real objection sitting on their side of the call. You've addressed it before they found the words to say it. That's trust built in 1 sentence. Step 2, short, simple, conservative. We use a very fine needle, takes about 10 minutes. We start conservatively. We'd rather do less and add a touch-up at 2 weeks than overdo it on day 1. You can always add more. You can't easily take it back. That last line is the most important sentence in the step. You can always add more, but you can't easily take it back. Few words that dissolve that overdone fear permanently. You're not just describing your clinical approach, you're removing the patient's biggest perceived risk. They're not locking into a result they might regret. There's a built-in safety net in this. And there's also a secondary reason that this step matters. The patient will go home. Their partner says, what did they, ask what did they say? If they can answer clearly, it's a purified protein, 10-minute treatment. They start light, so there's no chance of overdoing it. The confidence stays high. If they can't answer it, doubt will quietly set in while they're making dinner. You're not turning them into a clinician. You're just giving them a sentence that they can repeat out loud with confidence. Empower them. Step 3, we've talked about this in previous videos, but again, it's a step most front desks skip entirely. So a generic 3rd step would sound like, you'll see great results in 2 weeks. Most patients love it. Every clinic says that. It lands like wallpaper. Now, what an actual good step 3 sounds like, that's when the booking actually happens. So before you get to the value stack, you've been on discovery. If you don't remember about discovery, watch the relevant video. At this point, you know why they're calling. Maybe they told you. Maybe they asked you, or maybe you asked. Either way, you have it. You have something. Use it. You mentioned you've got your sister's wedding in July. Softening starts in 7 to 10 days, full result in 2 weeks. That gives you time for a small touch-up at your 2-week review if anything needs replaced or needs perfecting. Most patients then maintain every 3 months, but we talk about that once we see how you respond. Their event, their timeline, their result. That's where the booking happens. Not when you listed the areas, not when you quoted the price. When the patient heard their own life reflected back at them specifically. Because again, patients don't invest in treatments, they invest in outcomes. And the whole mechanism behind this whole framework is simple. Patients believe what comes out of their mouth more than what comes out of yours. When you mirror the stated outcome back to them with their own name and their own date, it doesn't feel like a pitch, it'll feel like a plan. Here it is in full conversational pace. The value stack as it sounds in a real call. Botox is a purified protein. What that means is it gently relaxes the tiny muscles causing those lines. It doesn't change your face, it just softens movement. We use a fine line, takes about 10 minutes, and we always start conservatively so we don't overdo it. You can always add more, but you can't easily take it back. You mentioned your sister's wedding in July. Now, softening generally starts in 7 to 10 days, full results in about 2 weeks. We do a small touch-up at your 2-week review if anything needs perfecting. Do you want me to lock it in your consultation this week? I've got X and Y available. That's it. One way you could even improve that, say, is there a day that works best for you this week to book in your consultation? I've got Tuesday available at 10 a.m. or Thursday at 3 p.m. Give somebody slots and make it feel like they're making the decision, but you've just shepherded them into 2 times. The thing to remember with the consultations, like I said, is that the further out, the higher the no-show rate. So you always want to get them in as early as possible. Give them false options. That is literally it. Really simple. Takes 90 seconds or so. They'll have some objections, but that's it. So what we've covered today. Number one, the moment a patient asks, do you do Botox, is the moment the value stack fires. Again, ideally, you'll mention the name, but what you say in the next 30 seconds decide whether they book. Secondly, step one is a clinical label plus plain language translation, or the patient's biggest fear pre-handled in line before they raise it. Beat them to the punch. You want to say all the objections that they're thinking of saying before they do, so they run out of ammunition basically. Step two is the mechanism plus conservative first reassurance, both under 30 seconds combined. And then step three is the step that most front desk skip, which is the treatment, which you tie back to the patient's specific state outcome, their name, their date, their event, and that's where the booking actually happens. All right, so super actionable one today in this video. Here's the simplest way you can put this into practice right now. Write the 3 steps on an index card, clinical definition of what you do, explain in layman's terms. Secondly, mechanism, but conservatively. Conservative first. Step 3, their occasion, their timeline, their result, and keep it at the front desk. So next time you get an inquiry, your front desk will know exactly what to do. Combine this with the steps we talked about before, the tonality, the 3 C's, the 4 steps, the call, you're on to a winner. You should be seeing some really substantial improvements in your performance. Again, as always, I always like to finish these videos with something practical. So I like there to be a team drill for your next morning huddle. Again, if you're not doing morning huddles, try them once a week, especially when we're just starting the predictable patient engine. So what you're going to do is you're going to pair up, and one person will play patient and open with, do you do Botox? The other will play the front desk and run the full script. One rule. Step 3 must include something directly that the patient mentioned, a real name, a real date, a real reason. Step 3 is generic, reset and do it all over again. 3 reps, under 10 minutes, video it, drop it into Slack, and we'll review. I'll see you in the next video.